Can surgery help fix a nerve problem around the elbow? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. People don't want to give up what they want to do. Sometimes they'll have surgery for it. Sometimes they'll take a short period of time off to try to get it better. They may wear a sling or a brace or a splint or a cast, whatever it is to get that injured body part to heal so that they can get back to what they want to do. But at some point, should you consider a pretty drastic treatment in order to get back, or do you consider giving up the activity altogether? In today's Ask Dr. Geier video, I'm going to answer that very question about a nerve problem around the elbow. Okay, Jacques asks, I suffer from subluxation of the ulnar nerve. I called it guitar elbow since I first experienced it while playing the guitar. I've had the condition for about 33 years now, and it's getting worse. It gets easily aggravated when I hold and twist something in my left hand. After the nerve flips over the bone a few times, I feel a little electricity type feeling in my arm and hand and fingers and get the shakes. This will prevent me from using a cell phone with my left hand. It's terrible. So I just use my left hand for holding and carrying, and I avoid any kind of twisting under pressure with it. I've given up hope of healing. My guitar is now for sale. Well, Jacques, I hate to hear that. But I think the point is well taken. At what point do you say, I'm just going to stop doing it, or do I go see a doctor or see a surgeon to see if there's something that can be done about it? Now, what he's talking about is a nerve on the inside of the elbow called the ulnar nerve. That's what you hit when you hit your funny bone, and it causes like a lightning type of pain that shoots down your arm into your hand and usually the fourth and fifth fingers. But that nerve can get pressure just from wear and tear over time. You see that in baseball pitchers a fair amount. Or you can have what Jacques has, where the nerve slips in front of that bone just along the inside of the elbow. That bone's called the medial epicondyle. And that's what he means by subluxation of the ulnar nerve. The nerve can slide out of the groove behind that bone and slide in front of it. And yes, it can cause those nerve-like pains, and it can cause numbness and tingling. Whether or not it's just pressure on the nerve or the nerve is flipping back and forth, it's worth seeing a hand surgeon because there are treatments. If it's just pressure on the nerve, sometimes you can wear a splint, sometimes you can take anti-inflammatory medications, and it can go away. Occasionally, though, you might need surgery to relieve pressure on that nerve. If the nerve is slipping back and forth over the bone, much more often surgery is needed. And what that involves is surgically moving that nerve in front of that bone and then holding it in place in front of the bone, holding it in place with a variety of different techniques to basically stabilize it there. Not only does that relieve pressure on the nerve, but again, it prevents friction on the nerve from repetitively sliding back and forth, and it can get better. Now, the question is, at some point, is it too late to do that? Probably not, although if you start to develop atrophy of certain muscles that the ulnar nerve innervates, then potentially it may not help as much. But yeah, a lot of times surgery can be very helpful either for compression of the ulnar nerve, cubital tunnel syndrome or ulnar neuritis, or subluxation of the ulnar nerve. Have you had an ulnar nerve problem at the elbow? And what did you do about it? Did you need surgery? Did you wear a brace or get some other kind of treatment suggested by the doctor or surgeon? I would love to hear your experience. So below this video, share your story, share your treatments and how you ultimately did. I would love to read it, and I know people viewing this from all over the world would love to hear your experience as well. And if you know somebody dealing with an ulnar nerve problem, please share this video with him or her, because hopefully I want to help as many people as I can with this video, so definitely share this video. Now, if you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. Click the box in the upper right corner of the page. I record a couple of these videos every single week, and I will deliver those directly to you. Thank you so much for watching. I hope it was helpful. I look forward to seeing you right here next time.